Hey everyone! I am Powell James C. Tabogoc and I will be going to discuss my topic which is myocardial infarction. So, does anyone here have an idea what is a myocardial infarction? So, wala. Let's start. Good thing. So, a myocardial infarction or heart attack is caused by a reduced blood flow in the coronary artery due to atherosclerosis or occlusion of an artery by an embolus or thrombus. So, it is the irreversible damage of myocardial tissue caused by the prolonged ischemia and hypoxia. So, a myocardial infarction daw is the end result of the myocardial tissues um, damage sa myocardial tissues which is caused by the ischemia and hypoxia. So, meaning to say that the lack of oxygen causes this kind of condition. Since an occlusion sa artery or an atherosclerosis is prevent niya or reduce niya ang blood flow tipakad to sa aton heart or myocardium. So, let us now proceed to the types of myocardial infarction. So, there are two primary types of myocardial infarction based on the electrocardiogram reading, which are STEMI and NSTEMI. So the first one is we have the ST segment elevation myocardial infarction or the STEMI. So the STEMI is a severe type of heart attack characterized by a complete blockage of one or more of the coronary arteries. So it results in a significant and sustained elevation of the ST segment on an electrocardiogram. So an STEMI is the more severe type sa kuan. Two primary types of myocardial infarction, and it is the more common type of MI. So, next one is we have the non-ST segment elevation myocardial infarction or NSTEMI. So, NSTEMI is a type of heart attack where there is a partial blockage or temporary disruption of blood flow in the coronary artery. So, kung sa STEMI is complete occlusion siya, ang sa NSTEMI naman is partial blockage pala siya or dili pa gud siya naka-occlude sin kuan toda. So, since dili pa good fully occluded or dili pa nakakaagi pa man talaan mga dugo, so mas madali niya, mas maopen niya prognosis and it is least severe kesa sa STEMI. So, there is also another way to classify myocardial infarction with the use of universal way of classifying it. So, the first one is type 1, which is classified as spontaneous myocardial infarction, and it is caused by plate rupture, ulceration, fissuring, erosion, or dissection resulting in coronary thrombosis. So, this is the most common type of myocardial infarction, and it is caused by a sudden interruption of blood flow to the heart muscle. So, an example sini is heart attack siya nga nag-result from clot formation sa aton coronary artery due to a ruptured leg. So, asya nan aton pihimuan pathophysiology later on. So, the next one is the type 2 supply or demand mismatch. So, there and iya pinaka-cause is a mismatch between myocardial oxygen supply and demand driven by a secondary process other than the coronary artery disease. So, ang type 2 myocardial infarction daw is a secondary imbalance between myocardial oxygen supply and demand, and it is completely unrelated to the coronary artery disease. So, such as mga cases sa severe anemia, coronary artery spasm, or increased workload sa aton heart. So, an example sa ni is a heart attack nga nag-occur due to severe drop in blood pressure, which is nagkukos siya inadequate oxygen delivery sa aton heart. So, the next type is type 3, which is suspected MI-related death. So, cardiac death in settings suggestive of ischemic process without definitive cardiac biomarker evidence of myocardial infarction. So, these cases typically occur before the cardiac biomarkers are obtained. So, ini nga mga cardiac biomarkers, they show up, nagpapakita ni sa aton blood after an aton heart has been, nag-undergo siya sa stress and becomes injured because it isn't, dili siya naka-get enough oxygen. So, she's not giving. So, an example to this is a person experiences cardiac arrest with ECG changes consistent with a heart attack before blood tests can confirm elevated cardiac biomarkers. So, the next type is the 4A or PCI-related MI rise in cardiac biomarkers accompanied by symptoms, electrocardiographic, angiographic, or imaging evidence of ischemia after PCI. So, nanugod ba PCI? So, PCI is percutaneous coronary intervention, such as, mga kanin siya parang way, para mga kanin siya process. So, such as angioplasty and stent placement. So, it occurs when there is an evidence of MI in patients undergoing these procedures. So, often manifested by the elevated cardiac biomarkers. And an example to this is a patient nga undergoing angioplasty, which is an example of PCI for a blocked coronary artery develops an MI during or after the procedure. So, the next is we have 4B, type 4B, which is classified as stent thrombosis. So, confirms stent thrombosis in context of ischemia and dynamic cardiac biomarker changes. So, sa type 4B, MI daw, it is associated with stent thrombosis where there is an evidence of myocardial infarction due to a blood clot forming within the coronary stent. So, it leads to the impaired blood flow to the heart muscle. So, an example sini is a patient who has previously received a coronary stent develops a blood clot in the stent leading to myocardial infarction. So, the next type is type 5 is CABG related myocardial infarction rise in cardiac biomarkers accompanied by the symptoms, electrocardiographic, angiographic, or imaging evidence of ischemia related to CABG. So, same ini siya sa PCI related, pero valuan la ang PCI into CABG, which is the coronary artery bypass grafting. So, this is one of the MI this is one of the cause of the myocardial infarction. So, at this point, let us now proceed to the pathophysiology of the spontaneous myocardial infarction. So, as you can see, these are the modifiable and non-modifiable factors that create or change the condition of plaque accumulation in the coronary artery. So, smoking, hypertension, and diabetes can damage the endothelium, which is the thin lining sa atong blood vessels. So, pag nahinaboy ni siya, pag nagkakamay na damage and endothelium, parang nagki-create ini siya way or space para pumasok ang cholesterol pakadto sa artery walls, in which nag-grow siya because sa aton unhealthy diet or unhealthy lifestyle, which we have like increased intakes ng saturated fat, salt or carbs na aton pa sedentary lifestyle. Anon. So, when too much plaque accumulates in the artery, nag-rupture siya or naputok. So, when this plaque ruptures, so naglilid ini siya sa activation sa platelets. Since ini na mga plaque, gina-activate niyan endothelial cells na nag-result sa elevated expressions of adhesion molecules and deposition of adhesion. So, ini na mga adhesion molecules and proteins nag-interact siya sa mga platelets na para bang gipupukaw ang attention sin mga platelets through their surface receptors. Then, adto na-activate na ang platelets. So, once na these platelets is na-activate na, nagpa-pile up siya sa nag-rupture na plaque, then padayon nga nagbi-build up sila acting as adhesion, parang itatapal, para tumukan rupture. So, in which, nagkakamay na thrombosis. So, based sa mga other report, ang atherosclerosis liwat, naglilid siya sa thrombosis sa aton artery. So, magkaya na nga ni sini nga thrombosis, which is caused by the mass build-up sa mga platelets. Ini na mga platelets, nagsisecrete sila thromboplastin. So, diri la thromboplastin. Nagproduce lang ini na platelets sin thromboxane A2, serotonin, and platelet factors 3 and 4. So, nagko-contribute siya sa coagulation and vasospasms. And we all know na pag magkayaon ini coagulation and vasospasm, ginpapa-enlarge niya ang thrombus. So, ang ending sini, ini nga enlarged thrombus ginpapanarong niya or ginuuklod niya ang atong artery. So pag nag-uklod na nga ng artery and diba kunyari artery ini siya ngasan parang adian thrombosis or enlarged thrombus ganon. So may blockage na nga ni, diri na siya nakakadaloy ang dugo ipakadto sa heart in which nagre-reduce ang blood supply. So, when this reduction happens, nagkakayaw ischemia sa part na ginsusuplayan sa blood na affected sa artery. So, in this case, the coronary artery is occluded, so there will be an ischemia sa heart muscle, specifically sa myocardium, which is the middle layer of the heart, and siya responsible sa contractile function sa heart. So pagyaon ischemia, nagde-decrease ang nakukuha niya na oxygen sa artery. So as a compensation to that is nagkakaroon na palpitations, and also chest pain occurs as a direct result of heart muscle not receiving enough blood. So other than that, the decrease in oxygen levels can cause hypoxemia, since the artery is the blood vessel that is oxygen rich, leading to weakness, panluluyang, fatigue, and also deep labored breathing, since the CO2 that is bound to hemoglobin forms a carbamino compound. So in circumstances where this CO2 and H plus concentrations are high, the affinity of hemoglobin for O2 is decreased. So when the CO2 concentrations are low, the affinity of hemoglobin for O2 is increased. So this is known as the Bohr effect. So low oxygen levels can also trigger the stimulation of sympathetic nervous system, which is considered as our fight or flight response. So an activation sini is asya an way para ma-ensure ang survival sa aton body while facing oxygen depletion. So this stimulation can trigger the epinephrine or norepinephrine, which are the hormones behind our fight or flight response. And if ini na hormones ma-release nga ni ini sira sa aton bloodstream, it will cause irregularity sa aton heartbeat, which eventually maglilid siya sa arrhythmia or increased sa aton heart rate. So since there is an increased heart rate, natitrigger niyan pag-increase ang aton metabolic rate, which is ang total calories na ginbe-burn sa aton lawas para makapag-perform kit sa aton basic life sustaining function. So usually kasi natitrigger ini which is nagkukos siya sa diaphoresis or sweating as a protective phenomenon in response to pain which is triggered by the increased heart rate. So diba, the low levels of oxygen stimulates the sympathetic nervous system. So this, in connection to this, the body may also activate mechanisms to increase blood pressure and maintain perfusion to critical organs. So vasoconstriction increases systemic vascular resistance, which in turn increases the afterload. So the heart has to work harder to pump blood against this increased resistance, which can contribute to elevated blood pressure or hypertension. So this stimulation of the sympathetic nervous system can also cause the redistribution of blood supply away from our digestive system. So meaning, pag ma-redistribute paharayo ang aton blood supply sa aton digestive system, there will be a this decreased blood in our blood supply sa aton GI tract, which is nagkakos siya inhibition sa aton gastric motility. So ini na inhibition sa gastric motility is nagko-contribute siya sa sensation of nausea, and also ini na redistribution away of the blood paharayo sa aton digestive system is gini-stimulate niya ang vomiting center sa aton brain, which will eventually lead to vomiting. So going back to the normal route, if this continuous depletion of blood supply into our heart maintains, the cells inside the myocardium will receive little to no oxygen, since the arteries man an oxygen-rich blood supplier. So an ending, magkakayon kita gintatawag na necrosis or myocardial cell death, since di man sila nakakakuha adequate oxygen sa blood supply. Kay waragod nga ni di ba naagi kay occluded. So after the necrosis, there are 4 factors that causes the decrease in contractility sa aton heart muscle. So, the first one is altered polarization. So, an altered polarization is an result sa disruption sa normal ion flow across the cell membrane during action potential. So, action potential is as an electrical event na nagda-drive sa contraction sa aton heart muscle. So, disrupted nga ni normal ion flow, meaning na siton, ma-disrupt gyap an aton action potential, leading to decreased contractility of our heart muscle. So, the release of of lysosomal enzymes is konsekwensya pag namamatayan aton myocardial cells. So, pag ini na enzyme ma-release, nagpa-participate ini siya sa tissue damage, inflammation, and remodeling process. So, sa condition sa myocardial infarction, pag-manage sini nga release is crucial para ma-minimize ang damage and preserve cardiac function. So, since ini siya, nagkukos ini cellular or stress damage that can decrease the integrity sa aton cell membranes, which is eventually it will lead to decreased contractibility. So next we have anaerobic glycolysis, which is the process of producing energy without the use of oxygen. So this can occur when in myocardial cells when oxygen availability is not sufficient. So sa context ng cell death, such as the oxygen supply to a portion of the heart muscle is compromised, leading to switch from aerobic metabolism to anaerobic metabolism. So, myocardial contractility is solely dependent in ATP, which is crucial for the contraction and relaxation of the muscles. So, next we have is the myocardial irritability, which is characterized by increased sensitivity to stimuli, occurs when myocardial cells die, such as in conditions like myocardial infarction. So, factors contributing to irritability include ion imbalance, release of intracellular contents, inflammatory response, altered conduction pathways, and remodeling process. So, myocardial irritability can lead to dysrhythmias and abnormal electrical activity, contributing to the decrease in contractility. So, ini nga decrease in contractility, it directly affects the ventricular function, as contractility is a key determinant of the heart's ability to pump effectively. So, a decrease in ventricular function, particularly a reduction in cardiac output, may indirectly influence the carbon dioxide levels in the body. So, with the portion of left ventricle no longer contracting efficiently, so stroke volume, which is the amount of blood ejected with each contraction, it is reduced. So, this leads to a subsequent decrease in cardiac output, the volume of the blood pumped by the heart per unit of time. So, the overall pumping capacity of the heart is nako-compromise. So, since the primary function of our heart is to supply oxygen-rich blood throughout our body, the compromission of the pag ma-compromise nga ni na aton pumping capacity sa heart, it will decrease the overall blood supply towards the brain, which will eventually lead to syncope or the sudden temporary or brief loss of consciousness. So that is for the pathophysiology. Let's now move on to the laboratory and diagnostic examinations or tests. So the first one is we need to conduct a clinical assessment. So in this part, the provider will assess the nature and the location of the chest pain, as well as the associated symptoms like shortness of breath, nausea, and sweating. So this information helps in making an initial clinical judgment. Next is electrocardiography, ECG or EKG. The ECG is a non-invasive test that records the electrical activity of the heart over time. It involves placing electrodes on the patient's chest, arms, and legs to measure the heart's electrical impulses. Specific changes in the ECG, such as ST segment elevation or depression, can indicate myocardial infarction. A STEMI pattern suggests a complete blockage of a coronary artery, while NSTEMI pattern indicates partial blockage or damage to the heart muscle. Next is we have cardiac biomarkers. So cardiac biomarkers such as troponin and CK MB are proteins released into the bloodstream when heart muscle cells are injured or they die. Troponin is the preferred marker for myocardial infarction diagnosis due to its high sensitivity and specificity. Blood samples are taken at specific time points to detect rising levels of troponin. So, the extent and timing of troponin elevation helps confirm the diagnosis, assess the severity of myocardial infarction, and guide treatment decisions. Lastly, we have imaging studies, which is optional. So, echocardiography or ultrasound is a non-invasive imaging test that can be used to assess the size and function of the heart. It helps determine the extent of heart muscle damage and any complications. Coronary angiography involves the injection of contrast dye into the coronary arteries and X-ray imaging. It is used to visualize the coronary arteries, identify blockages or narrowing, and guide decisions about interventions like angioplasty and stent placements. So, overall, these tests work together to confirm the diagnosis of myocardial infarction. The combination of clinical assessment, ECG findings, and elevated cardiac biomarkers is crucial for accurate and timely diagnosis. Early intervention and treatment are essential to reduce the heart muscle damage and improve the patient's chances of successful recovery. Next, let us proceed to the medical and surgical intervention. So, the medical and surgical interventions for myocardial infarction is aimed at restoring blood flow to the heart muscle and preventing further damage. So, the first one is the medical interventions, in which we will administer medications like antiplatelet agents, which are medications like aspirin and clopidogrel, are given to inhibit platelet aggregation and prevent further blood clot formation in the coronary arteries. So, also thrombolytics or fibrinolytics, in certain cases, thrombolytic drugs like altiplase or tenecteplase are administered to dissolve blood clots that are causing a heart attack. This treatment is time sensitive and is used when immediate percutaneous coronary intervention is not available. So, we also administer analgesics because pain relief is crucial to reduce the patient's discomfort and anxiety. Nitroglycerin may be also given to relieve chest pain and improve blood flow in the coronary arteries. Beta blockers are also administered because these drugs help reduce the heart's workload, decrease heart rate, and lower blood pressure, which can be beneficial in the acute phase of the heart attack. So, we also give ACE inhibitors or ARBs because these drugs help improve heart function and reduce strain on the heart muscle, particularly in patients with reduced left ventricular function. So, we also give statins, and these medications are used to lower cholesterol levels and reduce the risk of future cardiovascular events by stabilizing plaque in the coronary arteries. So, we also give oxygen therapy because in some cases, supplemental oxygen may be provided to increase oxygen delivery to the heart muscle, especially if the heart is hypoxic. So, next is we also give antiarrhythmic drugs. This is to manage and prevent abnormal heart rhythms that can occur during a heart attack. So, let us now move on to the surgical intervention. So, the first one is the percutaneous coronary intervention or PCI. PCI is a minimally invasive procedure commonly known as angioplasty. It involves the use of a catheter with a balloon at the tip, which is inserted into the blocked coronary artery. The balloon is inflated to compress the plaque and restore blood flow, and in many cases, a stent is placed to keep the artery open. PCI is the preferred method when possible as it provides rapid and effective revascularization, and it is especially indicated in ST segment elevation myocardial infarction or STEMI cases. So, I forgot to put it, but another surgical intervention is coronary artery bypass grafting or CABG. So, CABG is a surgical procedure that involves rerouting blood flow around a blocked coronary artery using grafts, usually blood vessels from elsewhere in the body. So, it is considered when multiple coronary arteries are severely blocked or when PCI is not feasible or unsuccessful. Also, CABG is more invasive procedure compared to PCI and is generally reserved for specific cases. So, in summary, the choice of medical and surgical interventions for myocardial infarction depends on the type and severity of the heart attack, the location, and the extent of the coronary artery blockages, and the patient's overall health. So, the primary goals are restoring the blood flow to the heart muscle, minimize further damage, relieve symptoms, and reduce the risk of future cardiovascular events. So, let us now proceed to the nursing management, which are assessment and monitoring, pain management, oxygen administration, continuous ECG monitoring, medication administration, thrombolytic therapy management if applicable, education, emotional support, wound care for PCI or CABG patients, and discharge planning.
That is all for my report. Thank you for listening.